Hello, this is the video presentation for the late-breaking work, a peripheral tactile feedback system for lateral epicondylitis rehabilitation exercise. My name is Jamie Ferguson, and this work was conducted by myself and Stephen Brewster at the University of Glasgow, in collaboration with Lorna at Glasgow Caledonian University. So firstly, what is lateral epicondylitis? So this condition is most commonly known as tennis elbow and is a painful and potentially debilitating condition brought on by overuse of tendons in the forearm. And contrary to the name suggests, most people who suffer this condition don't actually acquire it from playing tennis. It can be acquired from various different overuses of the tendon. So the most common treatment for this condition is physiotherapy. And as with any other kind of physiotherapy, there is a significant at-home component in most cases. So patients have to carry exercises in between sessions by themselves. And as with any at-home physiotherapy, adherence is a problem. There are many reasons why patients often don't stick to physiotherapy programs that they have been prescribed. For example, low self-efficacy. The patient's feeling that they would be more likely to conduct exercise if they were able to be accompanied by another person. The fact that exercise can often be inconvenient and hard to structure your life around. And finally, waiting times and other frustrations caused by the lack of access to physiotherapy, either due to funding cuts or backlogs and closures due to the pandemic. Our system, HALA, the Haptically Augmented Lateral Elbow Tendinopathy Aid, aims to confront some of these barriers to adherence. So the system aims to allow users to conduct eccentric wrist extensions correctly. And eccentric wrist extensions are a commonly prescribed exercise for alleviating and mitigating the effects of lateral elbow tendinopathy. So the system is set up like this. There's an inertial measurement unit on the back of the user's hand. On the palm of the user's hand, there's a haptic actuator, and these are both connected to a Unity application which processes the information and conveys feedback. So how the system works is that the user is given feedback when they reach extension and flexion points. So this is when the user raises their wrist. It tells them when they should stop, so that the user is extending far enough that the exercise is having the intended effect, but also ensuring that they're not going too far that is painful. And this is the same principle to when the user flexes the wrist down. Feedback is also given to indicate if the user is conducting the exercise at the correct speed. So feedback is given on whether the movement was too fast or too slow or in the correct range, allowing the user to adapt for the next repetition if they need to. And feedback is also given when the number of repetitions is reached. So the intended advantages of this system are, like I said, to confront some of the barriers to adherence for this kind of exercise at home. So the system aims to affirm the user that they're conducting exercises correctly. Like I said, it tells the user if they've moved in the correct range and if they have moved at the correct speed, confronting the self-efficacy barrier that I mentioned. The haptic feedback can make it easier for the user to conduct a secondary activity, such as having a conversation or being accompanied by another person. And the system can also be used in telerehabilitation, which during the pandemic as well as after will most probably become more common in order to be able to see the most amount of people in the shortest amount of time and deal with the reduced physiotherapy resources that many health services are facing. And finally, future work from this system, since it is a prototype, this is the most key area of this late-breaking work. So as I mentioned, physiotherapy post-COVID-19 is going to be a difficult landscape. So any ability to empower the patient at home is an advantage. There's potential for integration with hardware such as smartwatches and other devices that are already wrist-mounted, as well as the potential for gamification and application of this system to other areas of physiotherapy. Thank you very much.